Assalamu alaikum, Namaste, and good morning, respected principal, professors, lecturers, and my dear colleagues. Today I am going to present on the topic Unco-operative child-patient management in regular dental practice. Cooperative patient, जो बच्चा भालो मते काज करते थे. The patient who develop good rapport with the dentist and are interested in the dental procedure. They allow the dentist to function effectively and efficiently. Unco-operative patient, जो patient भालो मते काज करते थे ना, तो अनेक भय पाए और काम न करे. The patient who are not willing and ready to undergo dental treatment in a helpful way. The cause of lack of cooperation in child patient are being unwell or pain, fear, anxiety or distress, communication or language difficulties, unrealistic expectations, previous poor dental experience and frustration. The criteria of uncooperative patient are demanding or uncontrollable, and unwillingness to listen, verbal abuse or threat, physical violence against people or property, includes very young or with specific debilitating conditions and handicapping conditions. Behavior. Any change in the functioning of an organism is called behavior. Behavior guidance. It is a means by which dental team effectively and efficiently performs the treatment for a child and at the same time instills a positive dental attitude. Frankel's behavior rating scale. Rating number 1. Definitely negative approach. Refuse treatment. Immature. Uncontrollable. Different behavior and crying forcefully. Rating number 2. Negative approach. Reluctance to accept treatment. Immature, timid and willing. Rating number 3. Positive approach. Tense, cooperative, willing and timid. Rating number 4. Definitely positive, good rapport with the dentist, understanding and interested to accept dental treatment. The characteristics of commonly seen emotions in a child are distress or cry. Cry during childhood is a primary emotion expressed due to hunger and dislike to specific environment, etc. Different types of cry are obstinate cry, जो जोरी खाना करे और patient को kick or bite offer के बाद. Frightened cry, patient खाना करे, patient cooperative होइए चाहे पर अनेक भय पाए. Hot cry में patient खाना करे नो बोले cry करे और patient जब तुम देखा पाए तब तुम body को tighten करे और break hold करे. Compensatory cry में जब तुम patient के ऊपर काज करवा तब तुम patient अनेक broken sound produce करे. Anger, a child may be upset for reasons relating to dentistry, home or even school. Anger may be expressed in the form of throwing objects, running violently, kicking, biting, or even shouting loudly. Fear. According to Finn, fear is a primary emotion acquired soon after birth. It may be objective or subjective. Objective fear is produced by direct physical stimulation. They are the responses to the stimuli that are felt, smelled, or tasted, which are not liked or accepted. It is due to improper dental handling. Child often fear of white uniforms and smell of certain drugs or chemicals in the hospital. Subjective fear. Subjective fear and child has a miserable dental experience for a night or like from friends, relatives. Subjective fear may be imaginative fear and suggestive fear. Suggestive fear is acquired by imitating or observing the fear of the parent. Child's anxiety is closely related to the parental anxiety. The parents who are fearful or sad, the child is also fearful or sad. Imaginative fear. Imaginative fear, parent try fear exhibit, child unconsciously parent take fear in a regular way. For example, even cleansing of hand during dental treatment by the parent can create a suspicion in a child. Nature and value of fear. Anxiety. Anxiety is same as fear but without the reasons or fear of the unknown. Phobia. It is an irrational fear of something that's unlikely to cause harm. Factors influencing the child's behavior. Factors involving the child are growth and development. Growth means increase in size and development means progression towards progression towards the maturity. With the increasing physical growth and development, the emotional maturation of the child also develops. IQ of the child. Generally, high IQ child are more uncooperative towards dentists because they are aware of what is going to happen and they respond well to verbal assurance. Past dental experience. Here should be taken that first impression, make the first impression based on acceptable experience because the previous dental experience also determines how the patient is going to cooperate in a further appointment. Factors involving the parents. Family influence. If the parent is overprotective, then the child patient is shy, timid, and fearful. If the parent is overindulgent, the child is aggressive, demanding, and may show temper tantrums. If the child is if the parent is under-affectionate or under-rejection, then the child cries easily, shows anxiety, and they are attention seeker. If the parent is dominating, then the child is fearful of resisting openly and responds to the verbal commands slowly. Factors involving maternal anxiety. Child's anxiety is closely related to the parental anxiety. Attitude of parents towards dentistry. If the parent shows positive attitude towards the dentistry, then the child also inherits the same property. Factors involving the dentist. Appearance of the dental office. The reception room should be made clean, warm, and attractive, like it can be filled with toys or aquarium, etc., which a child can enjoy. Personality of the dentist. During first visit, the dentist will call upon the child by the nickname or first name, and the tone of the voice should not be so loud. Time and length of appointment. The appointment should be avoided during the nap time or during the time of emotional disturbances as well. The length of the appointment should be made as short as possible because the child cannot maintain the same position for a long period of time. Dentist skill and speed. If the dentist is skilled enough, the child are more keen to become cooperative. Use of fear-promoting words. Fear-promoting words like needle, injection, etc. should be avoided. Instead, euphemisms can be used. Like for LGN, pudding can be used. For high speed and peace, whistle can be used. For rubber dam, raincoat, etc. Use of subtle, flattery, praise, and reward. The dentist should be precise towards the child, and the dentist can often give them some gifts to encourage them. Behavior management can be achieved basically by two methods: non-pharmacological methods and pharmacological methods. Non-pharmacological method involves behavior shaping. The process is based on stimulus-response theory and principles of social learning. The process is based on planned introduction of treatment procedure so that the child is gradually trained to receive the treatment in a relaxed and cooperative manner. The different techniques used for behavior shaping are tail-so-do technique, desensitization, modeling, and competency management. Tail-so-do technique. This technique involves order explanation of the procedure in phrases according to the developmental level of the patient. So, demonstration of the procedure of the auditory, visual, and tactile aspects of the procedure in a carefully defined and non-threatening setting. 2. Completion of the procedure without deviating from explanation and demonstration. For example, patient will discover a key instrument like a triple series. So, patient को आगे बोलवा कि instrument आगे दिखाओ, like एक ही बात है class वाले. For example, patient के ऊपर 50 दिए लिखो और पानी दिए लिखवा किसी हो गए ना, और patient के ऊपर ट्रांसफर में जो बात है वो से और जो बात है ऐसे. Desensitization. It is the process for modifying the effect of phobia or fear. It is the training procedure to reduce the anxiety of sensitivity of the patient to a particular anxiety. Desensitization is patient को बॉक्स में this fear promoting stimuli को introduce करेगा और आस्ते-आस्ते करे more fear promoting stimuli को introduce करेगा. Modeling. This one uncooperative way में वो patient जो cooperative आसे order और if older patient ask older patient को withdrawal of reinforcers to modify a child's behavior is known as contingency management. It can be positive reinforcers or negative reinforcers. Positive reinforcers might be that presence variable where their topic are away. It is the one contingent presentation increases the frequency of behavior. Reinforcers can be the form of material, society, or activity. Material and entire gift karma, like toys, cartoons, speakers, chocolates, toothpaste, etc. Social manifestation to praise karma, on karma, back repair, high-five karma. Activity manifestation to favorite cartoon shows, TV shows, music, negative reinforcers. It is the one whose contingent withdrawal increases the frequency of a behavior. The person is told that if you do not cooperate well, then you will send your parent out of the room. And over mouth exercise. This method is used to establish communication with child who are able to cooperate or exhibit the hysterical behavior. The hand is placed over the patient's mouth and hand is removed as soon as the rhyme stops. Communication. The hallmark of successful dentists managing the children is the ability to communicate with them. Successful dentists in managing children is his ability to communicate with them and win their confidence. Effective communication with children is critical for gaining the trust of cooperation to receive dental care. Communication is accomplished in the dental office and achieved through dialogues, tone of voice, facial expressions, and body language. Physical restraint. Physical restraints are used to provide complete or partial immobilization of the patient and to protect the patient and dental staff from injury while providing dental care. Physical restraints used are any wrap is without the supporter or bodyguard, and any wrap is made of mesh. Triangular stick. The patient is maintained in upright position or it needs strapping. Tappus board. It is simple to use. Tappus board is available in various sizes to hold for small and large children, but it does not fit to the contour of the dental chair and supporting pillow is needed. Mouth prop. Mouth prop is used at times during injection to prevent the children from closing their mouth, which is produced by the fatigueness during long appointments. The pharmacological methods are sedation. A state of depression of central nervous system which reduces the anxiety, thus enabling the treatment to be carried out satisfactorily. During sedation, the patient will be able to independently maintain his or her airway, independently maintain the open mouth, respond sensibly to verbal commands, and retain all protective reflexes like laryngeal reflex. Conscious sedation. It helps active cooperation in a child by reducing the anxiety or maintaining the conscious state of the child. Child slowly verbal commands respond cooperative. Nitrous oxide. Nitrous oxide is a very quick acting inhaled sedation medicine that decreases the discomfort and anxiety. Action of nitrous oxide. It creates an altered state of awareness without impairing the motor function and is a central nervous system depressant. It increases the respiratory rate and decreases the tidal volume. Cardiac output is decreased and peripheral vascular resistance is increased, and this is important in case of cardiac patient. Rapid induction and reversal may induce vomiting. The indication of nitrous oxide are a fearful, anxious patient, certain patient with special healthcare needs, patient whose gap reflex interferes with the dental care, a patient with profound local anesthesia cannot be active, and a cooperative child undergoing a lengthy dental procedure. The contraindications are obstructive pulmonary disease, some emotional disturbance or drug-related dependencies, treatment with bleomycin sulfate.